All right, thank you everyone for joining us this evening. My name's Maddie. We're going to get started in a couple of seconds. We're just letting folks come in from the waiting room. And while everybody's coming in, we are actually going to start off our event with a poll. So I am just going to provide y'all with the information that you need for that. So while you're waiting, you can get started with this poll. What issue area is the most important to you that you hope will be addressed by the incoming administration? You can respond by going to pollev.com/AMSA197 or text AMSA197 to 37607. And we'll add that to the chat as well. And for anyone who's just joining us, welcome to our post-election Outlook event. We're going to get started in a couple of seconds, but while we're waiting, just take a couple of moments to respond to our intro poll. What issue area is the most important to you that you hope will be addressed by the incoming administration? All right. And while y'all are answering that question, we can get started. Hello, everyone. Thank you so much for being here. My name is Maddie Wren. I am AMSA's Kaiser Permanente Education and Advocacy Fellow for this year. We are so excited for our post-election Outlook What's at Stake event with all of the past national presidents that we could muster up. Before we get started, I want to just remind everybody why we're all here, what AMSA is. So the American Medical Student Association, for any of you who don't know, is a community of future physicians with a shared vision of a world where healthcare is accessible, medicine is affordable, and the systems we're a part of support and reflect the diversity of the world that we see around us. We are multi-generational, as this event is going to show us, but we share a common bond of activism and advocacy for our future patients and for ourselves. So with that, I will pass along the introductions to Ali.
Good evening, everyone. Thank you so much for joining us here today. My name is Ali Bukhari. I'm serving as your president for AMSA. So this year has been full of challenges that no one could have seen coming. We have a raging pandemic that's still not under control, healthcare workers and trainees left to fight without crucial tools, a national reckoning for racial injustice, and threats to the very fabric of our democracy that continue to persist today. But with the historic national election behind us, we're now standing poised for change at this time. And that's where we are honored to be joined by 4 healthcare leaders and former AMSA presidents to help us look forward beyond this election and to the next year and the next few years ahead. So we'll go ahead with some introductions here, and there's no better way to do this than by order of seniority. So we'll start with you, Jay. When were you involved with AMSA? How did you get involved with AMSA, and what are you doing now?
Great. Thanks so much, Ali, and appreciate your leadership this year and the AMSA team during what was just a tremendously challenging year with uncertainty. And I am so grateful to be part of this organization and have shaped my career. I started in AMSA in 2003 in Philadelphia. I was in a place where I almost was on my way out the door from med school, and it was AMSA that saved me. It was the local chapter in Philadelphia where I found community, like-minded people, values that I resonated with, and it started with the chapter doing work in West Philadelphia at the high school there, and doing some work in the community with screenings and various other activities. And so I found myself in DC at the Hilton that we know well in Crystal City, and ended up just being blown away by that experience and the people that I met, and knew that AMSA was going to be a part of my life from that point on. And so it has been, and I'm an internist and geriatrician now in Chicago, and recently just served as chief medical officer of the American Hospital Association. But now I'm a National Health Service Corps scholar, finishing my commitment on the south side of Chicago several days a week, and then working on a Medicaid ACO and a Medicare Advantage health plan in Chicago that's oriented around the safety net. So really excited to be here and talk about what was a moment and a tremendous moment in American history.
Thank you so much for joining us here today, Jay. Lauren, same to you. When and how were you involved with AMSA, and what are you up to now?
Sure. So I guess I'm the second oldest here. Fortunately for me, my entire time at AMSA, I've had the opportunity to know and serve alongside Jay. So my first contact with AMSA was 2005. And I was fortunate that my spring break in my first year of med school aligned with the national convention, also at Crystal City, the same hotel. And similar to Jay in terms of his sentiments during that first convention, I like to say I found my tribe, people that care about medical education and health policy and global health and LGBTQ issues and on and on and on, all those things that are near and dear to us, and just absolutely loved it. And 2005 was when it started, and I had the opportunity to serve as national president in 09-10, so the year that leading up to the debate leading up to the passage of the ACA. So a very unique year to serve in that position. I now live in Colorado, live in Denver, and moved here. Started a new role February 15, so 4 weeks before the world as we used to know it turned upside down. I'm the state policy director for the Farley Health Policy Center on the University of Colorado Anschutz campus. And I also do outpatient family medicine. Because of COVID, my clinical side of my life is completely upended. I'm not in my regular position yet. So I'm being shuttled around and plugging holes wherever it is that I am needed. Here on campus to meet the needs. So again, Ali and the rest of and Maddie and others, thanks so much for the opportunity to be part of the panel tonight.
Thank you so much for joining us, Lauren. Kelly, when and how did you join AMSA, and what are you up to now?
Thanks, Ali. So I'm Kelly Tibbert, and I'm from South Florida originally, and that's where I first joined AMSA at the University of Central Florida as an undergraduate medical student in 2008. I initially joined the pre-med club on campus, which was AMSA, to figure out how the heck to get into med school, and then got an email from National AMSA about, you guessed it, national convention at the Hyatt Crystal River or Crystal City. And so that was my first experience with National AMSA, which was pretty tremendous. I found that, similar to Lauren and Jay, all of the people interested and passionate about all the things that I thought were important to medicine and healthcare. And from there, I just caught the bug and continued through my life through AMSA. AMSA has really shaped who I am as not only a physician, but also as a person, and has really helped me find my lifelong friends and family. And it's been really incredible. I was honored to serve as national president from 2016 to 2017, right before going to family medicine residency in Columbus, Ohio. And I just finished residency in June of this year, and now am back in Florida on the West Coast and working in an outpatient family medicine setting. And so just my second month as an attending here. So excited to be here with you all. Thank you so much, AMSA, for including me in this really incredible event.
Congratulations, Kelly, on finishing residency. And thank you for joining us here. Isaiah, same question over to you. When and how did you join AMSA, and what are you up to now?
Good evening, everyone. So honored to be on with you all. So I joined AMSA back when I was a freshman in undergrad due to many reasons. Number one, was really great to see an organization doing the work that AMSA does. I went to school in Southwest PA in Greene County, the third poorest county in Pennsylvania, originally from Akron, Ohio, but AMSA kind of aligned very well with the mission of my undergraduate institution. So I said, why not? And with the help of a few others at my school, we started a chapter at my undergrad. I remember always reaching out to National AMSA, trying to figure out what we needed to do to be official. We actually received, back in that time, they gave out grants for chapter projects, and we actually got quite a few. And one of the things that we did that still sticks with me to this day was what we called hands-on healthcare. We went out to a few local high schools and middle schools to talk about fields in healthcare and how you could get involved and what it would take to get into college and what it would look like. And really thought that was powerful. And of course, through med school, I stayed involved and became even more immersed in the work that AMSA does, and was very honored to serve as national president last year. So I kind of definitely finished up with the tail end of my year was the start of the COVID pandemic, and we held our first virtual convention, and I felt like it went really well. So I'm looking forward to the second one this year. I just have to say it is very nice seeing folks that I know on this call, but also great seeing people I don't know. And it really shows me that people still view what AMSA does as so important. And now that we are going to be moving into a new administration, it is my hope that we can get a lot of work done. So thank you all for inviting me on tonight.
Well, it's a pleasure to have you here, Isaiah. Thank you so much for joining us.
For those of you who might be wondering where I'm at in my stage of training, I'm a first-year resident doing family medicine. So as you can see, family medicine is a theme amongst AMSA leaders. So yes, very excited and learning a lot. And as I was telling Maddie when I came on, I'm enjoying residency much more than I did medical school.
Wonderful. Thank you, Isaiah. Before we go into the first round of questions, as you remember at the beginning of this call, we asked you to use the poll and we posed the question, what issue area is the most important to you that you hope will be addressed by the incoming administration? So we'll just take a second to see what responses you've submitted.
Yeah, so let's take a look. Thanks, Ali. And for any of you who are joining us a little late, feel free to respond to the poll at pollev.com/AMSA197. So some answers that have come in during just the introductions include, so interested in COVID-19 relief makes a lot of sense, protecting women's reproductive healthcare and criminal justice reform, healthcare disparities in Brown and Black communities, the environment, thinking about the environment a lot, the economy, healthcare, more ideas on virtual. That might be, maybe that's our new administration with AMSA. Expanding healthcare, taking control of the pandemic, primary care, mental health, reproductive health access. COVID's coming up a lot. We've noticed a theme. And vaccine funding, development, and distribution, thinking about public health campaigns. So it sounds like we're all coming at this from similar perspectives, but this is sort of a way to frame our conversation tonight, thinking about what the next presidential administration what we can look forward to in the next presidential administration.
Absolutely. And so we'll also pose this question to our four panelists here today as well. What issue area is most important to you? You might have already answered it already. We'd love for you to expand. And also generally, how are you feeling in this post-election transition period, given the state of affairs right now? And we'll start with you, Isaiah.
So I am feeling optimistic and hopeful, but know that there is much work to be done. As you can see, we are hearing good news when it comes to vaccinations. Now, I know that the Biden administration is working very hard with what they're able to work with to help all of us who are dealing with COVID-19. Also, very important to mention that the elections are not completely over yet, as we have the Georgia Senate seats that are up. And so be very important to do our part to advocate for that. I know that Ali on the last board call said he is going to do his part to mobilize Met Out the Vote chapters in Georgia. And I'm very excited for that because Met Out the Vote was very successful for the general election that we had. As you can see, we had the most voter turnout ever for this past election, which was quite astonishing. And it just shows that everybody, not everyone, but lots of people went out and used their voice. So no matter what side they voted on, I'm proud that people are using their voices. The most important matter to me right now has to be COVID-19, and then I will say healthcare reform in general. That should come as no surprise, but so many people are afflicted by COVID-19, as you all are aware. And one thing that COVID-19 has done is heighten and highlight so many disparities that we see in healthcare, so many disparities that we see in other areas of our lives. And unfortunately, people of color have been more afflicted by this. And it was of no surprise to me because I understand that there are many people who don't have access to very basic things. And now we are seeing the deleterious effects of that. So it's my hope that AMSA can work very hard, as we have done in the past, to support the new administration, both in DC, but even more so in the local districts, because this is a group effort, and I really hope that we make some change there. So again, COVID-19 and healthcare reform are the most important topics for me right now.
Yeah, thank you so much, Isaiah. I have the same question over to you, Kelly. What are some of the most important issues for you, and how are you feel about the current state of affairs?
Thank you. So I feel and have felt relief for a while, knowing that there are people who will now be helping lead our country who believe in science and who also understand that racism is a public health issue and has serious effects on the folks who are living in this country. And I'm hopeful that we can continue to make change. So just like Isaiah, I am hopeful, but know that we have so much work to do. And I'm partially hopeful because of the work that I saw AMSA members do this past election cycle during the Met Out the Vote campaign. You all rocked this election cycle, and you shattered the voting records this year with folks in the age range that you all represent. And it's really astonishing to see and gives me a lot of hope for the future and moving forward. And even honestly for the Georgia elections, which I agree we have work to do on the ground there. And so things that I think are really important to me moving forward. I think Isaiah stole one of mine, healthcare access in general, seeing the expansion of healthcare access, especially during COVID-19, when we see people being furloughed and losing their jobs, which then ultimately means losing health insurance because so many people's health insurance are tied to their jobs, unfortunately, which is something that needs to be done away with, in my opinion. So working on that and just expanding access to healthcare. And with that expansion of access, ensuring that we maintain access to safe and legal procedures within our country. So with that being abortion care as well, and not restricting things that are already legal in our country, such as access to healthcare and abortion care, which is healthcare. So with that though, all of it honestly ties back to COVID-19 and just how that really impacts access to all of these things in general. We need to really work on a public health campaign and working with officials who believe in science and people who are scientists and physicians themselves to really lead the way into helping our country become safer and hopefully getting past this pandemic once and for all. So those are my few things.
Absolutely. Thank you so much for sharing that with us, Kelly. Lauren, we'd love to hear about what issues are most important to you and how you're feeling currently.
Absolutely. Thanks, Ali. And I think Kelly used a great word. I am relieved. I'm optimistic, both of which are tinged with exhaustion because not since the hanging chads of 2000 have we been waiting this long to know what the actual, the final result is. And so never thought that where we are at November 20th and still with all the legal challenges that and so forth that are out there. As I think back on the election, I certainly am so pleased from my worldview, a definitive popular vote victory, a definitive electoral college victory. Not quite the moral victory I personally have been hoping for. That said, when I take a step back, there's so much to be excited about. Beating an incumbent, flipping a lot of states, including, let's not forget Nebraska too, that one electoral college vote that's so important there. A first female vice president and minorities that see themselves in her. These things matter. And then the great, and Isaiah, you mentioned the greatest voter turnout that we've had. And I am at my most, fundamental, like, I want you to vote. I don't care who you vote for, but I want you to vote. I want you to participate in the process. And so pleased to see the numbers posted that we did this year. So that's sort of how I'm feeling about the election. And when I think about issues that are important to me, I mentioned, I'm a family physician, and I'm also trained in public health and health policy. And before, returning to academics, I was in governmental public health in the Commonwealth of Pennsylvania. And COVID-19, from my point of view, has really just taken the cover off so many things and exposed so many fractures in our frontline response, in primary care and public health and our social sector services. And so I would really love for us to focus on, especially the next 2 to 3 years, as we dovetail our way out of the significant health and economic crisis that has been COVID, to really focus on how we're going to strengthen primary care, align that with public health, and not just talk about, on the fringes, how are we going to pay for these things differently? Let's actually fundamentally finance and invest in these frontline defense, mechanisms that are so important for ensuring healthy communities. So that's not necessarily what is that our task we need to tackle tomorrow? No, we're in the midst of a pandemic and we need to shore up our response to COVID, particularly in rural areas. But looking ahead, a few months to a year or so down the pike, let's not neglect primary care and public health that needs some very significant investment.
Thank you so much, Lauren. Same question over to you, Jay. What are some of the most important issues to you, and how do you feel about this post-election period?
Thank you, Eileen. I would just echo the comments made by my fellow AMSA presidents. And I would start with saying that there was a backdrop going into this election, right? Countries experiencing immense tragedy and grief due to this pandemic. More and more cases, 180,000 just here today. We have failed on a response. There's racial justice sparked by the George Floyd murder, and it broke through America's conscience in new ways. Passing of Justice Ruth Bader Ginsburg, leading to the controversial confirmation of a new Supreme Court justice. And with that, the future, the Affordable Care Act, Roe versus Wade, LGBTQ rights, voting rights, and other key issues. What was encouraging and hopeful for me was the result that we hopefully will continue in this election. And I think Lauren said is really the people can see history in both a vice president as well as in local races around the country. And the voting turnout was encouraging. And you all spoke to that. One of the things that I also think is important about that is that new people voted. And when we look at behavioral science, if you voted once, you're more likely to vote again. So all those new voters, we still got to do the work to keep them involved and help them understand their vote matters. And I think Met Out the Vote and numerous other efforts have done incredible work in that. And certainly the work around voter protection in Georgia and many other places around the country. So that I think is important. The key issues, was COVID, affordability, out-of-pocket costs for consumers, health equity and racial justice, and the future of their ability to have care. The other long-term consequences that the election will we'll have is every 10 years, state governments have to redraw boundaries for congressional and state legislative districts based on the latest census data. And so the results, electoral results, suggest that Republicans might control more state governments than will Democrats, in allowing this redraw of the maps, which could have implications. And so also even more important to work so that Georgia turns blue. But, divided country makes governance harder. And it'll be really important for us to engage, again, as we said in 2016, this community of voters that has fundamentally different views and values, and understand, what is it that's causing them to want to support another candidate, and what we can do to speak to those communities. So the issues, I think COVID, got to get that moving, and we've got to further jump through the window and take the opportunity around health equity, which there's a lot of energy and momentum around now, and translate that into real progress. And I think about these policies. When in Katrina, we saw policies that were oriented around helping recovery that disproportionately impacted people of color and the poor poorly, in ways that they couldn't actually get the same amount of money around reconstruction, because the assessments were lower, even though construction costs might have been the same for one community that was more affluent versus another community. So I think those are some of the things that we got to continue to work on.
Absolutely. Thank you so much, Jay. Lauren, I want to circle back to you again for a second. You mentioned moral victories earlier. Many people view this election as a referendum of sorts on the fumbled pandemic response and this administration's treatment of minority populations, among other issues. So can you expand a little bit? And I know you addressed this a bit. Like, what is your takeaway on this topic, considering the margins of the election weren't as wide as some people may have wanted, or there's more deep-seated division than people might have expected?
No, I think you really sort of in essence answered the question the way I would answer it, Ali, is that I was commenting earlier that there wasn't quite the moral victory I was personally hoping for. I would have loved to have seen even a wider gap, for example, in the popular vote. But I think it is important, though, that you have 70 million or so Americans that voted for the current administration to send him back for a second term. That number is surprising, but it also helps us be clear about what are the issues that we need to address. Many of the things that Jay talked about, and Isaiah and Kelly and so forth. So that's important. I think one of the things that I've been also struggling with is that you did have 70 million people vote in support of this administration, and what that means and how that would be interpreted by my friends and colleagues and peers of color. And you hear these calls that say, we need to come together and in unity and move forward. And to Jay's point, there's been such a focus on social and racial justice this year, and I don't want those calls for unity to give us the easy way out or to bypass the really hard and difficult and challenging conversations that we need to have as a country. And I look at the 70 million people that voted in part for the current administration as additional evidence that we need to continue these really difficult conversations that are longstanding. So these are the things that I process and struggle with relative to my comment earlier around it not quite being the moral victory I had personally hoped.
Thank you, Lauren. Isaiah, I wanted to get your take on that as well. How do you feel about or process when you hear the 70 million people who voted for the current administration, given the policies that were instilled?
Not to be too accurate and get the exact number, but I believe it was 73 million now, and now 78, 79 million have voted for Joe Biden. I'm not shocked. I didn't think it was going to be a blowaway election, and I have many friends on both sides of the aisle, and I was talking to friends who are predominantly conservative, and they, socially speaking, they're our age in their mid to late 20s, and socially they believe in a lot of things that we believe in, but some people can be one issue voters, and that's getting kind of specific, but broadly, I also look at it as maybe a failure on the Democratic Party's part. And I don't want to get too in depth on this right now, but I do think messaging is a big thing. And that's something that, in AMSA, we always work on messaging and how can we speak to our members and speak to people outside of our group as well, because it's very easy, I think, to get caught up in the issues and very easy to think that everybody feels the way you do. But I know I learned very much last year that, speaking to individuals about the basic processes of voting and holding your representatives accountable and making, even if somebody that you voted for is in office, still making sure that they are going to stick to those issues. Many people cast a vote and then kind of move on. Not all, of course, but many do. So when we talk about this election, yes, COVID happened. And I know that for someone like me, I thought to myself at first, well, COVID, like, there's no way people could vote for him. But then I thought more about it. People, I think getting back to the failure on the Democratic Party's part, I think that messaging is huge, because so many times when you look at the news networks, and that's where most people get their information, they're not going online researching things, because again, people have their lives, people have things going on. I would really like to see a change in the way that our party and the Democratic Party messages and speaks to people about issues, because I think if we could get more focused on issues and explaining more clearly to individuals what's happening and what does happen and what has happened in the past, that could really make a difference. Working with Becky has been, Becky Martin, one of our staff members in AMSA. For those of you who are not aware, it has been an eye-opening experience for me, because when she talks about organizing, getting people to join your team, you have to explain why. But number one is providing that education and awareness to what the issue is. And that is why I believe we saw, and for other reasons, obviously, but I believe that is one of the reasons that so many people cast a vote for Donald Trump. And, you do have people that, no matter what, might not have changed their mind, but I do think that there is a good number of individuals who did maybe vote for Donald Trump in this election who, upon learning more, might not have.
Thank you so much, Isaiah. Jay, earlier you mentioned COVID, when we were talking about the issues that were important to you. Given the transition that's going on, what are your thoughts on the COVID-19 response for the remainder of this year, and then especially as we look out into the following year?
I think for the remainder of this year, we've got to continue to double down on public health measures we know work, and the masking, the distancing, and I think continuing to have those one-on-one conversations and community influencers talk to those that you may not know or understand what's happening. But then there's this related to that, a big set of actions we've got to take to fight misinformation, which continues to move forward. Now, I'm encouraged by the vaccines, but there's some considerations around that. One, they're not going to be available to a lot of people until next year. Certainly our colleagues who are on the front line, we need to protect them both with vaccination and PPE and other equipment. But the Pfizer and Moderna vaccines are studied around severity of illness and reducing severity of illness, not necessarily around infection and transmission. So we don't know how transmission may or may not happen with vaccine on board. We don't know how long immunity lasts. And when we think about the other issue, I think we need to work on a national testing strategy. We failed on testing, and I'm concerned also about deployment. We don't necessarily have a good strategy on vaccine deployment. So I think that those are two big issues, along with a national mask mandate and other elements, targeted measures that the incoming administration is planning for and will need to take as we move forward.
Absolutely. Kelly, I want to turn it over to you again for the same question on the COVID response for the remainder of this year and going into next year.
Yeah, I think I mentioned before, listening to public health experts, I am 100% in agreement that we need to do this if we're going to get through this pandemic. And I think we need political leaders to step up to the plate and believe in science and listen to the folks who do know science and that, that is their life, like Dr. Fauci, and to, protect the residents of their states that they were elected to represent. We see so many missteps in multiple states where cases just continued to rise and never really saw anything calm down this entire pandemic. So when people talk about a resurgence or a wave coming back, here in Florida, we've just continued on the up and up. So I know we're not the only state. Aside from just like a national strategy or concerns about COVID-19, I also want to highlight, particularly in medical education, the response to COVID-19. So often throughout the pandemic, we've seen physicians in training, so medical students and residents, really put at the forefront of this pandemic and not being protected, and sometimes even really being thrown under the bus by administration at different hospitals and by different programs, and not being protected as they should be. And so I think we really need to step up in terms of protecting our trainees and being there for them and helping them to care for our communities as well.
Ali, Kelly, I think was spot on around the science. The other thing I think we can't do is have our Senate wasting precious time and tax dollars on a hydroxychloroquine hearing. I mean, it makes no sense. That's even more important of why we need to get the right people in Congress there that'll be leading those committees so that they don't hold hearings that are just useless. We should be having a hearing around national testing strategy, around the science that we do know and the evidence that we do know. So that just can't happen.
Absolutely.
If I can,
Sure. Go ahead, Lauren.
Oh, just sorry. I'd add a couple thoughts on the COVID-19 front. And I couldn't agree more with Kelly and Jay on science. Yes, please. All of the science, all of the time. I am so ready for it. I think it's also important as we think about the transition teams and the COVID-19 Advisory Council and others as we move forward, to always take a step back. I mean, for those of us that are so excited to have competent scientists and physicians and other healthcare professionals engaged in these responses to the transition teams, it's wonderful. It's also important for us to take a step back and ask who is missing, what voice is not around this table that needs to be. I do a lot of work in rural health, in programmatic work, in policy, and in research. And there is not one person on the COVID-19 Advisory Council that has rural experience. And I'm working various channels to try to make sure my concerns are heard. But when you think about which areas of the country are being devastated right now by COVID, and thinking about challenges of the workforce and transferabilities and capacity, challenges getting needed supplies and equipment, that's rural America right now, particularly the upper Midwest and the mountain states and the Great Plains. And so critical to make sure that those voices that are on the front lines in those places are heard and included so that policies are not being made about them without them at the table.
Thanks so much, Lauren. And while I have you here, I do want to pose this next question over to you as well. Right now, especially in the midst of this pandemic, and given the recent hearings that took place for the ACA challenge, many are wondering about the state of healthcare coverage. What are your thoughts about the ACA, the public option, Medicare for all, and related policy?
Great question, Ali. So I'll focus on sort of the recent Supreme Court hearing on the 10th. I think leading up to the election and the hearing on the 10th, I was pretty worried about what the future fate of the ACA might be. In analyses that I've been tracking since then, I'm hearing increasingly from policy analysts that the individual mandate may be a piece that can be severed from the rest of the law and leave the rest intact. I certainly hope that the law stands, a majority of it stands, because I think that's going to be a critical place to start from as we move forward, particularly with the Biden-Harris administration, to use the ACA as an opportunity to build upon it, strengthen it, expand it when we think ahead to healthcare coverage and expanding that. So certainly hope that will be the case. If not, it's going to make a whole lot of heads spin come next June or whenever the decision is handed down.
Thanks, Lauren. And same question over to you, Jay, on your thoughts about healthcare coverage with the various different policy proposals for that.
I think that this is a critical area that there's going to be activity around. Now, the challenge is going to be, the balance between the progressive kind of voices in Congress versus the interest of a Biden-Harris administration to be closer to the center. We know that a president like Biden is typically in the center or more moderate. And then depending on what happens in Georgia, there are going to be implications there, as well as 2 years from now when the House races are in play again. We typically see that when Dems win presidential, that they have impacts in the midterms. And so that, is another thing to keep in mind. Now, I think that there's going to be a work done around a public option based on Medicare, protect and build on the Affordable Care Act. The marketplaces have to be, enhanced so that they're more affordable, and then strengthening and expanding the Medicaid program will be key as well. So trying to work on different ways to get expansion in the states and enhancing the waivers and other mechanisms we have, similar to Michigan, North Carolina, Pennsylvania, Maryland, and others, and then addressing coverage needs of immigrant populations, which are going to be important. There's a lot of people watching what's happening. It's the 30 million who don't have health insurance, 130 million with pre-existing conditions, those 70 million for whom Medicaid has eroded, the 700,000 homeless and their life expectancy, which on average we know is down 27 years with unstable housing, and the 40 million that go hungry, and an entire planet that's at risk because of climate change. So all of these folks, particularly those without coverage or underinsured, care deeply about this. And the affordability question is a bipartisan issue where there, I think, is real opportunity. But then you have the Medicare for All voices that'll certainly, be engaged in the discussion.
Thanks, Jay. Kelly, Jay talked about this a little bit. Where do you see the future of healthcare going from here in the Biden administration, especially when you're trying to balance the interests of people who would want to go farther than what has been proposed?
Yeah, I think that I do see an expansion of the ACA, and like Jay was just mentioning, right, expanding Medicaid, Medicare. In terms of a public option, I can't say that I can see that going forward as much as we probably want to see that happening, just given the potential outcome of the Senate race coming up here. And so just being realistic about how progressive of a change we can make in healthcare over this next 2 years. I know a lot of us think that we might be able to someday soon see single payer, but I don't think that's going to happen given how tight this will be. Even a lot of the proposed changes that I feel like Jay just mentioned will be contentious even within the Democratic Party of themselves, because I feel like expansion within different realms of healthcare is something that folks just cannot agree upon, and that they seem very progressive and even more left than just the general ACA. And so it'll be interesting to see how the party itself, the Democratic Party itself, kind of narrows that down into what they can agree upon in terms of expansion of healthcare access as well. But I hope to see us move forward, as AMSA always proposes, for a single payer system.
Thank you, Kelly. Piggybacking on that, Isaiah, would love to get your take on it, given some of the contention or the hard battles ahead of us. How do you see some of these proposals being considered and the balance that we have to try to achieve among different factions?
So as you've heard, I agree with what everyone else has said, but Kelly brought up a very good point that there is still contention within the Democratic Party on what should happen and what shouldn't happen. Do I think we're going to see single payer in the next 2 or even 4 years? More than likely not. But I do strongly believe that we will continue to take incremental steps towards something of the sort. Barack Obama did an interview about 3 or 4 weeks ago about the ACA, and they were asking him about it potentially being, taken apart even more. And he said, and I love this, the ACA was the bricks and mortar. It was a beginning of a good change. It wasn't the final change. And so when we go through making incremental changes, there will be things that are not perfect. There will be things that we need to make better. But I think number one, we also have to keep in place what is good about things, but then make them better. And that is what Biden is proposing. I would love to sit here and say that in 2 years before the midterm or before the general election in 2024, that we would have single payer or have at the very least some sort of insurance for everybody in our nation. I don't think that'll happen, but I'm always optimistic. I'm always positive, and I believe that AMSA, as always, like we saw in 2010 when Dr. Hughes was president, we achieved something very great in the ACA. And I think AMSA should and always has been one of the leaders when it comes to raising our voices and to do what is right. You all have such an important place in helping to achieve universal health care and making sure that all of our patients are getting equal and equitable health care. So don't forget that. It's going to be a fight, but we have to keep our eye on the prize. I also hope that it's during these 4 years that we are able to speak to some of our friends who may be on the other side of the aisle and may have the argument of, if we achieve universal health care, doesn't that mean wait times will be horrible and we'll be like Canada? And, these are things that you hear from people as to why they don't want to even think about universal health care. And I think that, again, it is very important for us in a non-inflammatory way to provide information to folks, because the more people we get to understand what is happening, the more people are going to then vote for individuals who have the same thoughts that we do. And that's how we can see change.
Thank you so much, Isaiah. And you touched upon something which intersects with, our very last question for the evening, which will be posed to all four of you. Before we do that, once again, we're going to pose the same question to everyone here attending this seminar as well. So if you can, the question is, what can future physicians and physicians do to affect change in the next 4 years? So once again, it's the same login, the pollev.com/AMSA197, or text AMSA 197 to 37607. As we're getting responses for this, we'll go ahead and we'll pose that same question over as the last question to our panelists here. Isaiah, I'm just going to start with you again. I know you just touched upon the role of AMSA in this. How do you see us affecting change as physicians, future physicians, given this climate in the next 4 years?
I want to say start with AMSA. AMSA has, of course, always been there to lead. And I strongly believe with you, Ali, and then Hannah, our president-elect who is on, who will be stepping in as our president next year in May, will continue to lead the charge. I think also picking an issue that you're passionate about. I think that as future physicians or young physicians, we think that everybody maybe wants to focus on broadly healthcare for all. But I saw in the chat earlier in the poll that someone had mentioned reproductive health rights. So focusing on what you're passionate about and finding other individuals who are passionate about it. Obviously, AMSA has a whole reproductive health program that we have going on right now. So AMSA can be there for you. But if AMSA is not as in tune to something, first of all, we're here to learn as well. And we'd love to be advocates when it comes to, let's say, doing more in regard to criminal justice reform. We've done a little bit, but we can definitely do more. I think finding a group of people, and then two, bringing other people along with you while you educate yourself can really be powerful over these next 4 years. As a physician, we are trained to be compassionate and to be caring, and it means a lot to be clinically sound and know what you're doing inside of the clinic. But in this day and age, it's not enough. We also have to be sound outside of the clinic and really stand up for our patients. So I can only say, find an issue that really, really means a lot to you, do your research on it, and don't be scared to write an op-ed. Don't be scared to write a letter to the editor. Don't be scared to, when we can, meet with our representatives. Again, right now, I know individuals have done Zoom meetings. We did that during our national convention. We had Zoom meetings with representatives and staffers from our representatives' offices. Don't be scared to use your voice. I hope that this election has shown you that your vote is important, but beyond your vote, holding our representatives accountable. So I know that we're very excited that Biden Harris might be in office. And we're very excited that, we may have the Senate. We have to see what happens. We're maintaining the House, but now that we have people in the House and in the Senate and in the White House who want to advocate for things that we care about, we have to continue to make sure that they do so. So voting was a number one step, but now we have to hold our representatives accountable. I think that that's what you can do over the next 4 years.
Thank you so much, Isaiah. Laura, I'm going to turn it over to you. What do you think should be the next steps for healthcare advocates amongst physicians and future physicians?
No, great question. And Isaiah, stole a lot of what I was going to say. So one, AMSA, of course. Number two, learn the issues and really dig in and try to understand that issue from a wide variety of perspectives. Number three, network with other peers and learners and mentors, again, from across the spectrum. And I think another really important skill that you can take the next 4 years and beyond, the rest of your lives and your careers to learn and understand, is how to truly engage in civil discourse with someone with whom you don't agree. We have lost that ability. Some days it feels like completely have lost that ability to listen first, learn, and then speak, right? Hear where someone is coming from, make that person feel heard and valued and seen. And you might be surprised if you do that, how much more you can get done. Maybe not as fast as you want, but we tend to get healthcare reform done through incremental changes. But learning to have discourse with someone with whom you don't agree is a really, really important skill set that I think will be very, very important for moving us forward on critical issues where we do align and can agree. So that would be, something I'd offer up because those skills will be very useful as, you already are change makers, but as you continue to learn and grow in your ability to do that moving forward.
Thank you, Lauren. Jay, same question over to you. What can healthcare workers and trainees do in terms of advocating over the course of the next 4 years?
Yeah, so I would echo Isaiah and Lauren's comments, and also add that one important action to take is think about how you can build a broad coalition. It's going to take diverse views and diverse people coming together, which we've done in many different moments in our history. The Affordable Care Act, marriage equality, to a number of issues over the course of the last 10 years. I think there's increased opportunity around mobilizing around racial equity and justice, which is going to require organization among health advocates to have the greatest impact, and bipartisan momentum around key equity issues like maternal mortality, substance use treatment, criminal justice. And I think that there's greater appetite for cross-sector collaboration, right? COVID's taught us that unlikely partners can come together, competitors can be cooperators, that we can learn from other sectors and industries, and we can go upstream around what might be impacting health. And I think that the pandemic has elevated the voice of science and clinicians in the midst of certainly those that are challenging it, but public health, medical students who spent residents. So physicians in training have played a really important role this year. And so I think that there's increased opportunity to continue to drive that forward. And public health officials are in tough places. They're getting challenged as well. So we're going to need the voice of medical students, the actions of medical students, and AMSA to advance some of these policies and actions. And if not us, then who? And if not now, then when?
Absolutely. And then last but not least, Kelly, the same question over to you. And I apologize for having you here last if a lot of the ideas were covered.
Thank you. So of course, I agree with all of these three incredible people. They've made really great points. I also think that we need to continue being the AMSA that we are and raising our voices no matter where the climate is and how people feel on particular issues. And so one of the things that I'd like to urge everybody within the organization, and also really just everybody involved and who cares about other people and healthcare in our country, is just don't let other people become complacent. I've seen so much through the pandemic that, once something's no longer trending, people are just complacent and it's not an issue anymore. And you get to go back into maybe your privileged life where you don't have to think about or see these injustices that are happening every day to people in the communities that we serve and in which we live. And so don't let people become complacent, even if it makes people uncomfortable. And I think that's something that we at AMSA are really good about doing, is speaking up about things that make people uncomfortable, because people who are living these injustices day to day, they don't get the option to live comfortably. So you shouldn't get the option to live comfortably by not hearing about it or not addressing issues. So we need to do that. We need to challenge our systems, and not even just like our national political system or our state government, but also think more locally too. Think about your residency program or your medical school. Challenge the systems in which you're learning and working, because medical education needs to be reformed, and it needs to be reformed to be able to talk about things like systemic racism and abortion care and the importance of single payer healthcare and how this will affect not only physicians and physicians in training, but our patients, right? We're so patient-centered as physicians, but the entire system doesn't allow us to be patient-centered. So we need to challenge our systems for that. And then I agree with Jay 100%, working like interprofessionally, right? So working with folks who you might not consider working with, speech pathologists or audiologists, right? Like people have all these different viewpoints as it comes to different topics that maybe you wouldn't have considered. Find your local community organizations, reach out to them and see what they're doing, right? Even religious institutions, right? People are all doing such great things in our community. We need to get out there and see what they're doing and work together as scientists, as physicians, and see what the communities are actually doing and needing, and really help one another to create the change that we must see in our world.
Thank you so much, Kelly. Before we wrap up here in the last minute or so, we pose the same question to you all on the poll, and we'll just go over some of the responses that you all submitted here. I think you're muted, Maddie.
Was just going to read off some of the responses that we got from folks. So these have been coming in throughout our speakers' responses. So it sounds like we're reflecting some of the ideas that were voiced, but organizing others and building coalitions, becoming fluent in policy. So getting into that education piece, advocating for racial justice efforts within medical schools to dismantle systemic racism within the House of Medicine, get involved with community-based organizations doing the work. So very similar to Kelly's point. Fighting to protect our climate, educate our classmates on social issues that are important to us. This one's a big one. Fighting pharmaceutical companies and speaking out in public, doing everything to reduce the opioid addictions. Provide as much as possible, even if that is through loopholes related to health insurance. Play the game, talk to community members from all fields about social determinants of health, legislative visits, mentorship, getting out the vote, reforming medical education, educate and advocate, and continue to speak up and advocate. So sounds like some exciting work needs to be done leaving this call in the future. So thank you all for participating in that poll. Fired up.
Ready to go. Thank you so much for sharing those responses, everyone. Thank you again to all of our wonderful speakers, Jay, Lauren, Isaiah, Kelly, for joining us here today. We have a lot of work ahead of us, and we'll be doubling down on our efforts. Just speaking of some of the efforts that we were talking about just now, on December 10th, we have our next AMSA Town Hall where we'll be discussing how to form relations with your members of Congress. So do join us for that session.